Cold therapy, a term coined by Sam Vaknin, is a method that has sparked much debate. This approach to NPD involves physical and mental re-traumatization. The method is not accepted by most licensed professionals as it violates the ethical standards of patient care. The method was developed by Vaknin, although he borrowed elements from earlier methods. Cold therapy is grounded on the assumption that through literal exposure to past traumas, physically while in a hostile environment, NPD patients have the opportunity to confront and overcome these emotional hurdles. Vaknin states cold therapy doesn't cure NPD, but patients will lose some of their narcissistic traits and cope better. But is this safe and effective? Is NPD a result of trauma, as Sam Vaknin postulates? It is not as clear. Experts disagree on the cause of NPD. Theoretically, this approach provides the patient the opportunity to confront, manage, and move past their trauma. It's crucial, nonetheless, to mention that cold therapy is not a mainstream method. Far from it. A key issue is the risk of physical harm. By re-traumatizing a patient physically, distress levels could escalate, potentially leading to self-harm or, worst-case, suicide. Moreover, there is a lack of robust empirical evidence supporting the effectiveness of cold therapy, period. It is not supported by peer-reviewed research. Leading professionals usually ignore this method or the legitimacy of such a therapeutic approach. The physical effects of cold therapy bring up serious ethical dilemmas. Despite the arguments in favor of cold therapy, many psychologists deem it not only unethical but dangerous. This therapy's physical aspect is appalling and shockingly dangerous and not allowed in North America. Multiple distressing descriptions have come to light, which Vaknin details in his YouTube videos. He states his clients experienced physical injuries, became violent, almost injuring him, and they were forced to re-experience traumatic events physically by him. This includes possible sexual abuse. As Vaknin stated in his video as an example, he would sexually abuse his clients if deemed necessary as per his judgment. In no sane world, this would qualify as therapy. It can only be described as torture, a form of sadism that may only help Vaknin, but not his patients. Moreover, it's a flagrant violation of any ethical guidelines that should govern the relationship between therapist and patient. The whole concept is deeply unsettling. It's crucial to point out that Sam Vaknin is not a qualified therapist. Instead, he is a self-proclaimed narcissist himself, though currently a professor of psychology and finance. Vaknin fails to consider his own boundaries and mental illness. Despite not being a certified psychologist or psychotherapist, he experiments on susceptible patients, predominantly in Balkans and Eastern Europe, lacks regulatory supervision. Keep in mind Vaknin's history with a well-documented prison record. Overlooking moral and ethical standards, therefore, is not uncommon for him. This is not a person to trust your mental well-being, even if you suffer from NPD. Please be wary and vigilant of such unethical practices parading as therapy. The damage they may inflict is incalculable, deadly, and any potential benefits far from being confirmed. It is important to remember that any therapy should be administered by a certified professional, using scientifically supported methods, and always with the patient's well-being at the forefront.